According to the CDC, 1 in 3 U.S. adults have high blood pressure. Many don't know it. When left uncontrolled, high blood pressure can lead to heart disease, stroke, and kidney disease. Nephrologist Dr. Daniel Richey with Dallas Nephrology Associates is here with more on the connection between high blood pressure and your kidneys. Good morning. Great to have you in the studio. This is something I would not have thought of. So first of all, what causes hypertension or high blood pressure as we know it?
So high blood pressures can be somewhat complicated. So the first thing patients need to know is just the normal aging process that can raise your blood pressure. Okay, so don't be surprised if you see that blood pressure increase with each birthday. Other than that, what people don't realize is there's a huge genetic component to high blood pressure, right? Mom or dad has it. There's a good chance that you may develop high blood pressure yourself. And then if you add in the fact that we don't all eat very healthy diets, right? It complicates things. And then in a very small percentage of patients, there's actually an underlying disease process that can cause your blood pressure to increase. So for example, kidney disease can do that. And in those cases, those patients would have to see a specialist.
So what is a normal blood pressure?
So best rule of thumb, normal blood pressure should be less than 130/80. All right, now your physician, based on other medical factors and other medical diagnoses, may decide that your blood pressure needs to be either a little bit higher than that or a little bit lower. But for people at home checking their blood pressure on their own, shoot for that 130/80 or less.
So you mentioned for people at home checking their blood pressure on their own. Is that something you should do, and how often should you do that?
If you're pretty healthy, you should at least check your blood pressure every few months. But if you have borderline hypertension or hypertension itself, it needs to be a regular occurrence to check your blood pressure at home. And some people, if you're taking medication, you need to be checking your blood pressure on a daily basis.
So how do you know when you're looking at that? It can fluctuate some depending on, if you're anxious about something. How do you know when to seek treatment for blood pressure?
So there's the general rule, if the majority of your pressures are above that 130/80 range, at very least you need to go have a discussion with your primary care doctor. And beyond that, they may ask for more information, more blood pressure measurements before actually deciding to do something about that.
And what kind of treatments are we typically talking about when it comes to blood pressure these days?
When you initially talk to your doctor, the first thing we usually recommend is lifestyle modifications. So simple stuff, diet, exercise, smoking cessation, moderation of alcohol intake. And probably the most important one that people don't think about or realize is salt consumption, right? That drives a lot of our blood pressure, and by simply changing some of those factors, you can get your blood pressure under better control. And in cases where that doesn't do the job, that's when we have to talk about taking medications.
So what kind of problems does hypertension result in, and specifically when it comes to the kidneys?
So, hypertension, it's a disease of our blood vessels, right? So the complications that people really know about, heart attack, stroke, those are fairly well known with long-term hypertension. But what they don't realize is kidney disease is very common with patients who have long-standing hypertension, because the kidneys, the small filters in the kidneys are essentially just a collection of blood vessels. And over time, they get worn down, and patients don't know it. So not only do they have to monitor their blood pressure, but if you do have hypertension, you need to get blood work checked so you can monitor your kidney function.
Really good information. Thank you so much. I never would have known that. Thank you so much. We appreciate your time this morning.
Thank you.
Dallas Nephrology Associates has 32 area locations, more than 100 healthcare providers, and has been treating kidney patients for more than 20 years. To learn more, call 214-358-2300 or 877-654-3639. You can also go to dneph.com.